Hello, my name is Thomas Biscaldi. I'm a PhD student at LabTo, which is a French laboratory specialized in therapeutic application of ultrasound, and I'm going to present you a part of my work, which is a dual-mode ultrasound interstitial catheter for ultrasound image-guided conformal HIFU therapy, and I'm going to present you an experimental validation of thermal ablations in the liver. First of all, I'm going to deal with the medical background, and for this, I'm going to deal with the hepatocellular carcinoma, which is a primitive tumor that represents 13% of digestive cancers, and it has a steadily increasing incidence. Currently, the best treatment is grafts, but it's very rare because we don't have enough grafts. So people use an interstitial thermal ablations, such as radiofrequency, microwave, or cryoablation. The main problem with these techniques, one of the main problems is that the radius is kind of small, and if they want to increase the radius, they have to use multiple needle, and it really increases the complexity of the operation. The other main problem is that these ablations are not conformal. It means that the shape of the lesion doesn't fit the shape of the tumor. And that is a huge problem because if, for instance, you have a stomach, which is near a lesion, a tumor in the liver, it could be very dangerous to treat this tumor because we could damage the stomach. For all these reasons, there are a lot of recurrences. Here is an example of a non-conformal disjunction. On the left part, we have a liver, and within the blue circle, there is the tumor. Usually, in the majority of the cases, the lesion is bigger than the tumor, but in the worst cases, it's rare, but sometimes the lesions is huge compared to the tumor, and we destroy a lot of healthy tissues of a healthy liver, and that's of course something we don't want because we only want to treat the tumor. The solution would be to use a bimodal ultrasound interstitial probe. For the scientific context, some work were done a few years ago on the HIFU planning with the first prototype that we can see here on the right part of the screen. The goal was to put here in the first image the probe in a tumor, to do some images, then to do a rotation or a translation, do another image, and then repeat these steps over and over again, and then we can reconstruct a three-dimension volume. If there is another way to explain, here on the image on the A image, we have a tumor mimic. On the B image, we put our probe in the tumor mimic. On the C image, we do several images with rotation of the probe, with translation of the probe. And with this, we can reconstruct on D image a three-dimension volume. Then we can, on the C image, do, it was modeling, we can do HIFU therapy. Here, pick some points on the 3D volume and choose to treat some part of the tumor. Here is the modeling of this treatment. For the material and methods, I'm working currently with a second probe, a second version of probe, which is here, which is 3 times bigger than the old one, longer than the old one, because the probe is 3 millimeters diameter and has 64 elements. It means 64 wires that we have to put in this 3 millimeters diameter. The frequency that we chose is 5.5 megahertz, and here is an image of what our probe can do. I forgot to mention that it's with the same probe that we do the therapy and the imaging part. It's a dual mode catheter, so we can do imagery and therapy with the same probe. We also use the Verasonic systems Here's the Vantage 256 Verasonics. With this kind of system, we can easily do the therapy and the imagery part. For the results, we studied the way to focus with our probe. Here is an unique focalization, and as we can see, we have grating lobes. We expected, of course, to have these grating lobes because of the pitch, because of the frequency that we use with our probe. But the problem is that these grating lobes, we can't control them. The experience shows that the modeling was true, as we can see here. So we decided to study the multifocalization here, and we have 4 lobes that we all control here. The experience shows again that we don't have that the modeling was true, and here we don't have grating lobes. We have 4 lobes that we can control. On the unique focalization, we have 3 lobes, but 2 of them we can't control them. For the modeling, here we have a map of temperature with 4 lobes here, and we have this kind of lesions for a treatment of 10 minutes with an intensity of 10 watts per square centimeters. So the goal was for us to perform 10 watts per square centimeters with our probe in intensity, because the modeling shows that it's something that can allow us to perform lesions. Here is an acoustic measure of the intensity, and we see that we perform this objective of 10 watts per square centimeters. It was kind of hard to perform this because of the cooling system, which is very, very hard to put in place because of the dimension of the probe. Here is a video of focalization. Here we focus at the surface of the water, as we can see here. Then we decided to do some in vitro experiences on a pig liver, as we can see, with 2 experiences that show that it's possible to perform some lesions, as we can see here. We put a thermocouple in front of our probe in order to detect some temperature elevation. We are still currently doing more experiences on it in order to have more lesions. I would like to thank Romain L'Huillier, Laurent Milot, and Aputu Engine, who are working with me on this project. And I also would like to thank BPI, the FAST Foundation, Ministère de l'Enseignement Supérieur et de la Recherche, and the LabEx Dev Weekend. Thank you for your attention.